talking about all hazards preparedness, but a lot of what we do does boil down to S&S and medical countermeasure dispensing. And this is an idea that we've had, the dispensing task force concept. Now I want to emphasize that this is just an idea. Our office, working with our special populations work group, we came up with an idea, we wrote a plan, we haven't tested it yet, we haven't exercised it yet. However, we thought it was a good idea, so that's why we're bringing it here to you today. Now a little bit of background about the City of Detroit. The City of Detroit, 717,000 residents, 144 square miles, and has a lot of challenges. If you happen to be watching CNN yesterday, you'll know that our former mayor is finding himself in prison for the foreseeable future. And as part of a CRI, we need to provide prophylaxis within 48 hours. The bread and butter of mass prophylaxis is that push method, the pull method, bringing people into pods. And so we have plans to set up a large number of pods across the City of Detroit. However, pods come with challenges. People standing in line for a long period of time. You need a lot of staff and volunteers to make a pod work. So of course, there's other alternate dispensing methods. There's your drive-through pods. These are great. People can drive up, you throw their medication in the window, they drive away, don't have to get out of the car, no lines, nothing like that. However, Detroit may be the motor city, but a full third of our population doesn't even own their own vehicle. So of course there is that push method where we have closed pods, and closed pod partners are great, getting community partners and businesses to take care of their own people. However, there aren't a whole lot of large businesses in the City of Detroit, and the unemployment is roughly 20%. Another challenge, our senior citizens. They live in, most of them live in city-owned high-rise facilities. However, they don't have the infrastructure. There's no organizational body that can provide for them a closed pod. We have a large homeless population. This is another group that may be a little adverse to standing in a long line in a public facility waiting for their medication. Another group that may be a little gun-shy, so to speak, from a public pod could be our illegal immigrant population, which unfortunately we do have that population in the City of Detroit. And for those who do want to come to a public pod, and if they don't have a car, well, how are they going to get there? Well, the City of Detroit, as you I'm sure are well aware, has some funding issues. We have public transportation, but it's unreliable at best. So, we've been meeting with our special populations work group saying, how do we take care of these people? And we came to the conclusion, if we can't bring the people into a pod, and we can't box up a pod and give it to the people like a closed pod model, why don't we take a pod to the people? And that is where our dispensing task force came about. A task force under NIMS compliance is a group of unlike resources. It's public health employees, volunteers, and law enforcement working together to travel around the community and build mini pods for a couple hours at a time across the City of Detroit. They function just like a regular pod. They're going to pick up their medication from our distribution node. We have pod kits, which are large Rubbermaid totes that we take out to our public pods. Well, there's 13 of them stacked on a pallet for our public pods, so we're going to boil that down into one kit that'll fit in the back of a minivan, and we can take around to these different facilities. They function just like a regular pod. We're asking all of these locations where we may set up, all we need is 2 8-foot tables, 4 chairs, and a locked room to store our materials. And at those 2 tables, we're going to do registration, screening, dispensing, education, and exit. And it's a very quick, simple thing that we can put up, stand up, and tear down in a few hours if we need to. Law enforcement is another key component of this. Now, they may be sitting outside in a patrol car, they may be standing next to the table, and, but it's flexible. So again, working with our special populations work group, we are coming up with a list of different facilities where we may take this dispensing task force to, so that when that bad thing does happen and we do need to activate it, all we do is we can start going down our list, calling, saying, hey, can we schedule you to send a couple people over and take care of your seniors in your facility or your homeless population? And hopefully they're going to say yes.